Hello and welcome back to The Halfway Point. As primary care professionals, we're privileged to meet people from all walks of life. We often focus on clinical conditions, long-term health needs and operational pressures. But what about the experiences that patients carry with them every day that may not be immediately visible on a medical record? For people living with a visible difference, whether that's from a birth condition, injury, cancer treatment, skin condition or another cause, everyday interactions can sometimes be challenging in ways that many of us may have never considered. So today I'm pleased to be joined by Malou and Vikki from Changing Faces, a charity that supports people with visible differences and works to create a more inclusive society. So before we start then, Malou and Vikki, if you could introduce yourselves and tell us a little about your roles within Changing Faces. I'll start with Malou first.
Yeah, so I'm Malou and I lead on healthcare professional engagement within Changing Faces, very much raising awareness among healthcare professionals about the psychosocial impact of living with a visible difference. And I have been engaged with charities and the NHS for many, many years. And I think this is an area that absolutely needs a lot of scrutiny and, like I said, awareness raising, because it's so important for people that live with a visible difference.
And Vikki?
I'm Vikki. About 2 years ago, I was diagnosed with cancer in my nose and had to lose most of my nose to save my life. I have navigated healthcare settings both as an active treatment patient and beyond and during my reconstruction journey, and then just as a person trying to seek healthcare as I go through life. My condition meant that I had a visible difference from day one. So I've done all of that looking differently and really experienced the whole journey of healthcare.
Well, thank you both for that intro. And for listeners who may not be familiar with Changing Faces, can you tell us a little bit about it and kind of how it came to be and the support you provide?
Yeah, so we've actually been around for a long time. We were set up in 1992 by Dr. James Partridge, a very remarkable man who himself was burnt at the age of 18. And he wanted to share that really long process of rehabilitation, the pain, but also that impact of then having that visible difference, not necessarily recognizing yourself in the mirror after you had your treatment, what you looked like, and then the impact of that on people around you. So that constant staring, how do you deal with it? How do you prepare for that? And how do you react as a person, I guess, to your whole life changing? And that's what we're here to do, to support people with a visible difference. Like I said, very much around that psychosocial impact, feeling happy in yourself, feeling resilient, accepting who you are, but then also making sure that society as a whole is aware of those consequences. The impact of staring, for example, I know people who can't leave the house without someone staring at them the whole time. Very challenging for anyone to deal with. And we're here for children, families and individuals, adults. So it's very, very important.
Okay. And do you know is there a number on how many people in the UK are kind of estimated to be living with a visible difference? Is that known?
Yeah, the number is around millions, so it's a part of their community.
That's a lot higher than I initially thought then.
Yeah, so visible difference doesn't just affect the face. Don't forget that sometimes, for example, someone can experience a burn and will have a lot of scarring on their arms or legs.
Yeah.
So I know we're talking visible difference with the face here, but there is a lot of other changes that can impact on people as well.
Yeah.
Okay.
I think a lot of that number, you've got things like acne, eczema, like skin conditions that they may not always attract a stare, but it's something that people are living with.
Yeah, and I was just going to ask actually some of the common causes then, but so it's not just the injuries that we spoke about then, but it's down to acne, down to eczema, all those other conditions then as well across the body. Okay. And so let's start with a big one then. What assumptions do people often make when they see someone with a visible difference?
There are a lot of assumptions that are made that somehow the person is of lesser intelligence. It can be that they're seen as being evil. We all know the Bond franchise where people are often shown with scarring. It's a very lazy way of indicating that people are somehow outside of society's norms, which is really bad. I know, speaking of acne, for example, that people are dirty, they don't look after themselves, they can somehow infect other people. So there's a lot of really negative stereotyping that is associated with it.
Okay. And then, that kind of leads into the misconceptions as well. But what do you feel that the challenges then that the people at Changing Faces support, what are they facing in their everyday situations, just so we can get a picture.
Vikki, would you like to answer that one?
I think Malou alluded to the fact that isolation is probably one of the bigger ones.
Yeah.
And a constant barrier to everything you do, because whether I'm going to the supermarket, trying to get antibiotics for a sinus infection, or just taking my daughter to preschool, the first thing anyone sees when they look at me is my appearance and the fact that my nose looks different. And that changes by the day. So I don't know how different I'm going to look. If I'm having a good day and I haven't just had a surgery, some people say, oh, I didn't even notice. And then if I'm having a day like today, where 2 weeks ago I had surgery and I've got a bit of an infection, well, it's very obvious. I went out today, everyone stared at me. It was like always looking at what's wrong with her, what's going on. So I think the isolation, the social isolation that comes with that, like try as he might, my husband, my family, they will never understand how it feels to just walk out of my front door or do those little tiny tasks like going to the supermarket. And that we all have up and down days, and that some days, yeah, sure, I'm like, everyone else is the problem, it's not me. And then other days, it is a real hurdle that I have to get past, and something that is going on in my emotional state without my daughter having a tantrum in the supermarket, or like it being difficult to get a GP appointment, or whatever else adds stress to my day. That is just an undercurrent of stress. I think if I look back to when I wasn't leaving the house at all, and the impact on my mental and my physical health of, like, we all know that movement is good for our body. I don't need to explain the physical implications of not leaving the house to exercise and get sunshine and be in nature. But we also know that it's good for our mental health. And very quickly, you can slip into a depressive state if you are either living in that world where you don't feel you can leave the house, or you are having a bad day. And we all know the best thing to do would be to get outside and move and touch some trees. But if you just feel like you can't, then it's very easy to slip into that depressive state, and then also feel so isolated that you can't get the help that other people may easily access.
Okay, so that's a real thing there, where the physical is then affecting the mental health, and then it's a loop, isn't it? Yeah. And then you don't go out the house, it makes the mental health worse.
Yeah.
So looking at it from a healthcare setting then, so what feedback do you hear from people with visible differences about their experiencing when accessing healthcare?
Well, I think a lot of the problems is that people make assumptions when they see someone with a visible difference, and they automatically assume, for example, that is actually why they're in the appointment. So I've had people say to me they've gone in, for example, with a sore throat, but because they come in with a visible difference, that's the very first question. And I know I had a conversation with Vikki. And you were explaining it really well, Vikki. It's that almost, well, why did I even bother coming in when I'm not actually going to be asked what it is I'm concerned about, and what, they'll just push it back to the visible difference when they're not linked. But again, Vikki, maybe you'd like to explain that a little bit better, because I think that was really impactful when we spoke about it.
I think the example that I gave to Malou, and I think I said to you, Ben, when we spoke, was way back after I just had treatment, I developed a sinus infection, which is very common. I've been radiated to the area of my sinuses, and I'd had chemotherapy, so my immune system was on the floor. And I raised an e-consult through my GP surgery, and as is standard practice, they fired me off to the pharmacy without second thought. And I was told to turn up to the pharmacy. I turned up. At that point, I just had a hole in my face, and the pharmacist took one look at me and was like, I cannot treat you. And I'd already overcome the hurdle of going all the way to the pharmacy. At this point, I hadn't left the house other than to go to a hospital appointment. So that was massive for me. And I'd done that, and she just took one look at me and was like, no. Didn't even ask. So pinged me back to my GP surgery. And then I got stuck in this ping of, oh, it's just a sinus, you need to go to the pharmacy. In the end, I had to phone up and say, I have a hole in my face, you won't look at me. And then the GP saw me, but it was I've had a sinus infection before in my life. I know what it feels like, I know what it is. And I was asked all of these questions as if oh, you might be experiencing this just because you've got a hole in your face. And I had to really fight for the antibiotics that I needed. And I'm not a medical professional, maybe there were reasons, but it just felt like they just looked at me and gone, oh, it's because of your nose. And it was because my nose was different. I couldn't then just have a run-of-the-mill sinus infection. And I've experienced it a few times where I'm having perimenopausal symptoms, and they take one look at me and they say, tell me all about all your treatments and all of that. And yes, it's related, but it's on my notes, you could filter through. My periods probably aren't linked to my nose.
I'm not clinical, but I know where you're coming from. Yeah. So that's a really good interaction. And I was thinking about this after we spoke and was like, it sounds like the appropriate action was the GP. And again, I caveat that with the non-clinical. I just knowing where the pharmacy first process is, it might not have been appropriate for the pharmacy. But if we'd have had an alert or something on the record to say, not appropriate due to X, Y, Z, then that would have saved you that wasted trip out to the pharmacy. And as you said, when that's a big deal to get out of the house that day, we'd like to keep the interactions as positive as needs be. So, if you've got to come in, you come into the GP waiting room and you sit at the GP rather than the pharmacy and then to the GP. And in fact, actually, was that dealt with remotely when it went back to the GP, or did you come in and the GP see you?
So I had to come in again, and there was I had said to the lady, I don't really like to go out. The idea of coming in and sitting in a big waiting room is that's quite intimidating to me. Can I just turn up first thing in the morning and go? And she was like, no, you've got to come and wait with everyone else. And there was no private area of the waiting room that I could go and sit in, or like a smaller holding room or anything like that. Just to be aware of the fact that I don't really want to sit in a room where all the chairs face into the middle and everyone can stare at me for
yeah But also the risk of just an infection if you're not long off surgery, and your body's recovering, it might be appropriate from a medical point of view to have you somewhere sat different if that's what you need, rather than, as you say, go in the corner unless the person wants to sit separately.
Yes, yeah.
So I think that leads into kind of how important is language then when we're interacting with our patients. So again, looking at it from like a non-clinical side, on the phones, on reception, that side of things, what can we do to kind of improve our language and the way we interact?
I think that's a hugely important question, and getting back to people with dermatological conditions, very often seen almost as trivial, and actually people can be in such a state of anxiety that they're actually having suicidal ideations, and I think that can sometimes be forgotten. And obviously, if you go in, for example, and you start saying to the patient, well, your skin looks particularly crusty today, it's very scaly, you're very red, those kind of things can act as huge triggers for people. And I think obviously each individual is going to have their own way of describing what they're going through. But I think it's very important that the GP and the staff in the practice are mindful of that and just consider with the patients actually what kind of language should be used, how they approach that. I think this whole concept of think before you speak is really, really important. Yeah. And remembering the human you're seeing in front of you and not the condition.
Yeah.
Okay.
Yeah. For me, I think a really big one is that we don't always have to talk about it. Like if I'm there to talk to you about my perimenopause, you don't need to start the conversation by saying, "Oh, your nose is looking really well. Have you had the surgery?" Is that Like I didn't walk in there for you. If I walked in just normal, you wouldn't say anything.
No, that's true.
And I appreciate the same stands for like obesity and people that are struggling with their weight. Just, oh, you're looking slim. Like, we don't always have to talk about somebody looking differently, and you wouldn't if they looked normal. Like we just went. You might say, oh, like if you're feeling particularly sprightly one day, you might say, oh, you're looking glowy. But as a general rule, your doctor doesn't comment on your appearance. But I get that all the time. It's usually the first thing, oh, hey, how are you doing? Oh, your nose is looking really well. Your face looks less puffy. And it comes from a really good place. I'm not saying they're trying to compliment me, aren't they? But it's quite, I just thought I'd go one day without someone talking about my nose. It's because then it's immediately you pull it into the room, don't you?
Yeah,
and you're not seeing me as a patient. You're seeing me as like somebody attached to my
condition.
Nose. Yeah. So I think that language awareness is really important. And I was also really surprised that I was never pointed in the direction of a charity or an organisation like Changing Faces.
Interesting.
You get given all manner of leaflets and all manner of materials. Even like the menopause is a good example. There are loads of websites and things that give you in surgeries now. And I was never ever, even when the GP phoned me to do a mental health check to just see like how are you getting on with everything, never told that Changing Faces existed or anything like it. I just stumbled across them myself on a Google search.
That's really interesting then, and that's certainly then an action I hope we can take from this episode is that we'll put all the resources in the show notes and everything, but if nothing else, can we put a leaflet on the waiting room TV, a thing on the waiting room TV or a leaflet in with the others or on the website, social media. You know, we have such a large reach with, especially on social media now, when practices get it right, that you post something out, and even if it's not directly the patient who sees it, you know, they might have a relative or something similar, and at least then that can hope to get more awareness and more support. So I guess looking at it from a practical point of view, then what's a good example of a practice where you know, the patients come in, seeing the reception team, that admin team for the first time. What's a good example of it going well? You know, you've talked about some of the ones there where it's focusing on particularly in your case, Vikki, on your nose, even if you've not come in for that. So I'm just trying to think how we can make it work on a good example, really. So I suppose gold standard, if you like, but it should be normal standard, let's say. You know, what works well in those cases?
I think, and trying to be far-reaching rather than just personal, I think the admin of having, as you suggested, a flag on the system, because we are all just humans, and it would be unreasonable of me to think if I walk in the GP surgery and they have no forewarning that I look different, they're going to say something or ask a question or make an assumption. Like, we're just human beings. So having a small flag on the system that says, by the way, this patient has, or they may look differently for this reason. Obviously, pictures are the ideal, but that's a way off on the systems, as I understand. But I think that would really help, because then there's that preparedness, and your brain doesn't do the magic that our brain does, where it leaps to the first efficient solution and says it must be this because I'm presented with it. I think having patient preferences, I don't know if there are like a section where you can note patient preferences, like don't talk about my skin, don't do this. I think having the right resources to hand. So if somebody comes in and they are talking to you about a skin condition and you get an idea that they're feeling quite low, being able to furnish them with Changing Faces or an organisation that's similar, or a support group, in the moment is a lot more effective for their long-term well-being than prescribing antidepressants. Or like in the short term might fix the problem, but they're still 20 years down the line potentially going to be feeling awful and alone in what they're doing. And I think the note on the system as well will help with the remote consult journeys, where I raise an e-consult and I say this happened, and they say, oh, okay, the patient might need privacy. So you offer that to me, because I'm very good at advocating for myself. A lot of people aren't. If I was having a bad day, I would have no problem just saying, can you sit me in a corner somewhere? But a lot of people won't feel they can ask for that. A receptionist phone you and say, we'd like you to come in. There is a more private space if you'd like it.
Yeah.
Then that might be a really good option as well.
Yeah. And you mentioned e-consult there, but I'm thinking also on the telephone, you know, anything where they can't physically see you.
Yeah.
You know, and build that picture physically is the same in this process. So yeah, recording the preference, and you know, we can add photos onto the clinical systems, but they don't. It's not like they pop up when, you know, like not like a profile page and appears, unfortunately.
Yeah.
And so I guess on that then, I think there's a big thing around awareness and training and stuff like that. So is there support for both, well, clinical and non-clinical, really? So to help them understand visible differences?
Yes, I mean, I'm always very happy to come out and do awareness raising. We have some fantastic resources also on our website. And I think that is the main thing, isn't it? Is actually being willing to hear about the situation and being willing to accept that actually it is something that you need to have more knowledge around. But I think it's very much that sort of psychosocial stuff, isn't it? And looking that up and understanding how that impacts on people.
Yeah.
Because I think most people are extremely good at the clinical. I mean, that's what they're there for in the first place.
Yes, exactly.
But I think understanding that psychological impact on patients is hugely important. And like Vikki said, you know, that's where you actually enact prevention, because you're not going to have so many problems further down the line if you can actually help people with resilience from the start.
Okay. And I suppose just expanding on that then, so how do you think organisations can create a culture of inclusion? So we talked about like the individuals and our own training, but a lot of these areas I find it's got to come from the top down, and then that creates that ethos of the company, the practice, the hospital, whatever it is. So kind of, are there some tips, some quick wins that we can kind of start today to try and change in culture, so that you've got people, staff know how to respond or communicate more appropriately in the ways you've mentioned today?
I think the awareness is a really, really big one. And the awareness of your language, like we're all guilty of it, and we live in this very visual world that's all about your appearance and I love this, I love that, and we just do it. So I think changing the focus on appearance and people showing up, and changing the focus on the need for in-person and the way the system is. So like if it's, oh, you have to phone up and then you have to come to the surgery and collect X, Y, and Z, and then you have to take it to a pharmacy. If there's any way we can reconsider those systems for somebody who maybe can't reliably show up on a Wednesday because they feel too ashamed to leave the house, or going to a pharmacy is quite intimidating to them. So is there any way, like the elderly have a lot of these tools, don't they, where people bring things to their homes and things like that. Is there any way that can be offered? And just considering flexibility in the system for things beyond the obvious, I suppose.
Yeah, it's an interesting point. I've done some work with a similar charity around access and looking at physical. So like your checking screen, for example, is it wheelchair height? Can you transfer from a chair to a couch or whatever it may be? And they're quite, lack of a better phrase, hot topics in the sense that we've got a lot better with accessibility. Taking into account a lot of infrastructure changes, we've got some very old buildings to contend with. But it's interesting to hear both of yours point of view from a changing faces point of view, from those visible differences, because it's not something we immediately think about. But I think it does blend into when we talk about inclusivity. It's everything. It's so every patient is treated the same.
Yeah, and it's easy to almost like cast judgment. Like just because I physically can do something doesn't mean I emotionally or mentally can that day. And I may have done it last week, but it doesn't mean I always can. And I think it's very easy to be like, oh, of course we'd all love it delivered to our house. Be lovely,
yes.
But yeah, it's that understanding, like you say, we understand a lot that people with physical disability will struggle to do things, but just because I physically can doesn't mean it's always easy for me to do so.
I think that's around also universal design, isn't it, about access and making sure that you design for everyone. But I think that also comes to that human aspect of actually seeing the human in front of you. We're all people at the end of the day. We all deserve to be treated with warmth and respect, and that we feel seen as human beings. So I think from that point is that universal understanding of humanity in a way, and that really shouldn't be that difficult. So I think that for me is really important.
Yeah, I'd agree with you on that one. And I'm just trying to think, I think the example you shared about the waiting room and having a private space, that doesn't necessarily need to be a private room, but I'm just thinking about kind of what we can do today to like review our environment, communication and all those processes. So I think, can you look at your waiting room chairs, as you said, are they all pointing inwards, or is there a way you can have some chairs in the corner for, well, equal like yourself, but in theory, anyone who's having a bad day.
Yeah.
Mental health or not, we're all human, as you said. So having a quiet space as well, and we think of like autism and other neuro spaces as well, where there's a quiet space to sit and wait. That's something that we can look at almost from day one. Is there anything else kind of expanding on that you can think of, even if it's more long-term planning and investment? What's your kind of thoughts around, improving that environment and communication further?
I think continuity of care would be really good.
Okay, so,
I'm part of a group practice and I see a different doctor every time. But when I do get lucky and see the same doctor as I've seen before, I have a far better experience because they've got over that immediate assumption that it is my nose, and they've gone, okay, actually, yeah, we can do that. Whereas if every time you see a different GP, you need to explain, no, it's not my nose, it's this, and you have to prove them wrong again. And for somebody who is maybe feeling less confident on a given day or just in general, that continuity of knowing it's somebody who's seen you and that you're comfortable, aren't you? And you've got a bit of rapport. I think that would be really, really important. Okay.
Anything to add on that one?
I guess it's just recognizing as a practice as well, if something has gone wrong, how can you actually reflect on that and make sure that everyone is upskilled and trained on that particular situation. And obviously CPD is a very big aspect of any practice nowadays. And I think that should be used then to make sure that you are providing the best care for every patient in the practice.
Okay. And then I suppose going further then, how can primary care teams become advocates for inclusion and understanding, whether it's changing faces or just broader afield, kind of is how do we continue to promote important services like yourselves?
Well, I guess it's staying curious and being informed, but it's also about having those resources, whether it's just a poster on the wall or whatever, knowing the patients in your clinic. I know that obviously many GP surgeries, for example, now have posters up for dementia care, that kind of thing. But actually, with visible difference being such a prevalent thing in the population, I think it's really important to be mindful that resources should be up for that as well, so that people can actually see it. And nowadays with QR codes, it's so easy. Most people could go up and just scan that poster and get that information, and then they can go on and find out more themselves. We have a brilliant support and information line, for example, that people could just ring and find out a bit more and have that discussion.
Okay, yeah. Anything from you there, Vikki?
I think similar to Malou, really, it's worth considering on the websites as well. Like we've spoken a lot about people maybe not making it to the surgery. So it would be worth considering on the websites, on pharmacies when you are picking up prescriptions, just having that awareness, and almost like, the Talk to Angela posters that's like, would you like something to be different, and inviting people to ask for change that might make them feel more comfortable, because it would be unreasonable to expect healthcare as a whole to be able to predict every individual's needs. There are so many different visible differences. But having that open conversation to say, could we do better for you? Just ask a receptionist for a private word, speak to the pharmacist, scan this code and let people know. That would be really, really powerful, I think. And
we can do lots of text message templates, for example. So, we can have organizations like Changing Faces on a text message. So, and then it's whilst in the consultation, a couple of clicks and that sends them the link. So then the patient's got that to look at in their own time. Yeah. So that's really helpful. I think in wrapping up, if you could give one piece of advice to kind of focus more on the non-clinical members, so the practice management team, the reception, the admin, care navigation, if you give one piece of advice to those staff working in general practice to help you guys out, what would it be?
I mean, for me, it really is about that. See the person in front of you and think before you speak. It is about providing holistic care. And I think, that goes it's so important, it's not just the language you use either, it's your body language, the tone of voice, all of those kind of things. So I just say be open and welcoming and do the best for the person in front of you.
Okay.
Yeah, I'd follow on from that just to say it's the compassion and understanding, the remembering that the first thing to go is usually confidence and self-worth. So if you look at the person you're dealing with the understanding and compassion for the fact that they probably aren't feeling like they can advocate for themselves, ask for their needs very boldly, and just put an invitation out there for them to do so and show that they matter.
Oh, that's a lovely note to end on. And I thank you both for joining me today, but also for your openness and honesty as well. We can't face some of these things sometimes without actually going to the root of it and being open and honest with each other to make a difference. So, thank you again. It's been fascinating and a really incredibly important conversation, especially as non-clinical staff. We might not always provide direct clinical care, but it seems when we often provide the first interaction a patient has with a healthcare service. So the way we communicate, welcome and support people can have a lasting impact on that experience. So I'll put the details for Changing Faces in the show notes, and any kind of resources we talked about today, I'll put a link into there. But otherwise, Malou and Vikki, thank you both for joining us again today. Thank you all for listening, and we'll see you next time at the halfway point. Thanks both.
Thank you.
Thank you.
Thank you for joining us today for another episode of The Halfway Point. We hope today's conversations has given you a fresh inspiration and practical ideas you can take straight back into your practice. You'll find all the links and resources we mentioned in the show notes at locumpm.co.uk. The Halfway Point is available on all major podcast platforms in both audio and video formats, so you can tune in however suits you best. If this episode helped you, we would genuinely love to hear from you. Leave us a review or a comment. Not only does it make our day, it also helps us shape future episodes around what matters most to you. Make sure you follow and subscribe so you do not miss next Wednesday's episode. And if you know a colleague who would benefit from this conversation, please share this episode with them. You can also connect with us on LinkedIn and Facebook by searching for the Locum Practice Manager. We're on YouTube too, where we share practical tips and tutorials for primary care managers. Until next time, keep moving forward, keep improving, and we'll see you again next week at the Halfway Point.